the preparation phase, the nurse in charge is to deploy staff to dedicated OR 5. Ensure the staff have a way to communicate. All unnecessary equipment and supplies are to be removed from the operating room. Ensure portable HEPA filter is placed inside the OR. It is preferable to move the HEPA filter intake to head of bed during intubation, moving back to the doors after intubation with intake towards the center of the room. Turn HEPA filter off prior to incision. Turn HEPA filter back on once dressing is applied but before extubation. Activate security with ample time for transporting patient to and from operating room. Ensure all equipment is covered with plastic or cut hip drapes. If a C-arm is needed, place it in the OR prior to patient arrival. The OR runner is to place airborne isolation signage on doors, then seal the doors the best that they can. They will serve as a safety officer, ensuring the proper donning and doffing of PPE. Place equipment on PPE cart including N95 masks, plastic isolation gowns, shoe covers, gloves, face shields, PDI wipes, and red trash bags for hallway and substerile. Place empty table in substerile as a transfer device. A case cart with supplies and instruments are to be kept in the hallway. OR nurse and scrub tech are to don full PPE, prepare operating room accordingly, and cover sterile field. Circulating nurse is to pass all additional consumables or instruments to runner before patient enters OR. Park patient stretcher or bed in the corner of the operating room. Keep cabinets and drawers closed. Do not open for supplies once patient is in the room. Anesthesia provider is to don full PPE. Place anticipated medications and airway adjuncts on respective designated carts. Change outer gloves and perform hand hygiene after contamination and before reaching into cart, changing vent settings, charting on EMR, or touching any equipment. When induction is in the operating room, circulating RN and technician will remain immediately available outside OR door in substerile area, ready to start once the airway is secure and following a 30-minute post-intubation pause prior to entering the OR if possible. Refrain from leaving the OR unless absolutely necessary. For the intraoperative phase, place any requested items in the cart in the substerile room. Contact OR runner if you require any other items. Retrieve requested item from the cart in substerile room. Any unused consumables or drugs placed in OR intraop must be discarded. Minimize the cautery and utilize smoke filtration system. Ensure adequate seal around trocar to avoid air leakage. Desufflation should be performed via closed filtration system like an air seal. Consider use of helmets if post-lavage, drills, or saws are to be used. If using helmet system, staff must continue to wear N95 mask in addition to helmet. In the post-operative phase, facilitate transfer of patient post-operatively via designated access door. Patient will be recovered in the operating room. Ideally, anesthesia will stay with the patient and recover. Circulating nurse and anesthesia provider are to transfer patient back to unit. Activate security 30 minutes prior to transfer. If you have a specimen, place the specimen in plastic container with lid, then inside plastic biohazard bag. Do not touch outside of bag with dirty gloves. Send directly to lab. Transporter only needs to wear gloves. Balance all controlled drug entries before patient leaves the operating room. Throw away or wipe down all pens or stethoscopes used. Place instruments on cart, spray and cover cart with biohazard signage. Remove instruments prior to extubation. If unable to remove instruments prior to extubation, pre-treat, cover, and keep in OR until air exchange has occurred. Manage instruments in accordance with normal IFU. SPD staff should minimize spray or splash and scrub or irrigate underwater per normal guidelines. For the removal of PPE, The items to be removed in substerile room are gown, gloves, and shoe covers. Items to be removed outside substerile room are your N95 mask, shield, and cap. Don new cap outside substerile. All personnel must change scrubs following the case. For the follow-up phase, utilize disinfectant protocols. Do diligent and thorough terminal cleaning to include all equipment, keyboards, monitors, etc. Transport staff must don new PPE, including N95 mask. Instrument sets are to be sent directly to SPD. Discard all plastic covers and drapes. Operating room should be isolated for 1 hour for adequate air exchange before cleaning. Terminally clean OR and reapply fresh covers on all equipment. Always remember to do proper hand hygiene. And replenish supplies. Thank you for all that you do.